Welcome to a special Youth Day episode of the AMREF podcast called Empowering Youth for a Healthier Future. I'm your host, Halima Sabwa. We are celebrating the power of youth and the power that they have to drive change in the health sector. Joining me are Gideon Toimasi, Chief Engagement Officer at Youth Senate Kenya, a passionate youth leader and an advocate for health in our communities, and Grace Naserian, a youth advocate at AMREF Health Africa in Kenya. We will be discussing the role that young people have in shaping the future of health, the challenges that they face, and the innovative solutions that they are implementing. Now, guys, Grace, Gideon, before we start the podcast, I have a special challenge for you guys. And so the challenge is I'm going to ask you 3 questions. And then in these 3 questions, you guys are going to have to answer correctly. And then the winner gets this cake.
Wow. Sorry.
And I almost dropped my laptop. But you guys will be getting a cake. I'm not even going to tell you what type of cake it is, but it's a yummy cake.
All
right. So question 1. Did you know that drinking water can boost your energy levels? So, which time of day is considered the best to drink water for an energy boost? A, morning, B, afternoon, C, evening, or D, before bed?
I think in the morning.
Actually, Grace got it right.
Oh.
Okay, so now what we'll try to do is that just answer at the same time.
Okay.
So then we give each other like a chance.
All right.
Okay. All right. Did you know that one of these public health campaigns led to significant reduction in malaria cases in Africa? Which campaign was it? Roll Back Malaria, Stop TB Partnership, Immunize Africa, or Safe Motherhood?
Immunize Africa.
No.
Safe back malaria or something like that. The first one?
Roll Back Malaria. Imagine Grace got it right again. Okay, and then last question.
Yeah.
Did you know that one of these vitamins is crucial for boosting immune systems? Which vitamin is it? Vitamin C, vitamin D, vitamin B12, or vitamin E?
Vitamin C.
Yeah.
Oh, girl child.
Okay, so Grace won with 3, and I'm sorry, but like, come back and then we'll try again.
Girl power.
Grace, here is your cake. Thank you so much for participating.
Oh, wow. It's a Black Forest cake.
Great.
Thank you.
You're welcome.
Yeah.
As a youth advocate for the Youth Senate Kenya, what problems do you feel exist in the Kenyan health space?
Number 1, we have issues to do with matters access to health care services from the very rural parts of Kenya. We know that Kenya is largely rural, and if we compare the access that the urbanities of Kenya have when it comes to health care services, it means that they are way ahead of the rural parts of Kenya. So basically, there is a challenge when it comes to access to healthcare services from the very rural parts of Kenya. Number 2, we know that devolution came when systems were not very strong, and today we have issues with administrative matters of health when it comes to the devolved units of Kenya. Like for Kajiado County, for instance, we have very inefficient management in terms of the healthcare services and the systems as a whole. So basically, we need to do more in terms of strengthening the county governments so that they can provide such services. Another thing is that we have corruption that is affecting the healthcare systems. When it comes to corruption, maybe budgeting has been done to manage and to strengthen such facilities or the provision of the services. We find a case, for instance, where there is a budgetary allocation that has happened, there is money that has been allocated for such provision of services. But when we look at the absorption of the development budgets when it comes to bettering the structures and the infrastructure around healthcare and facilities, we find that there is a problem. So basically, that is another issue. And the other thing that we see around the same is the inadequacy in terms of equipping such facilities with the right trained staff and the facilities equipment that is needed to run the systems. Then we can see that there is a problem when it comes to the equipment and resourcing the institutions of healthcare services when it comes to such matters. And the other thing I believe is that there is a problem when it comes to preventive care, because for the non-communicable diseases and such like stuff, there is a problem because right from the very weak systems, we can see that our people from the rural parts, even those from the urbanities, they're still struggling when it comes to preventive care. So that is a challenge.
That being said, that there are gaps that do need to be bridged, and I feel like having dialogues and trying to work in terms of policy and making sure that what is happening on the ground actually is happening on the ground is beneficial to everyone.
Okay.
But I mean, don't just say okay. If you don't agree with what I said, you can.
Well, I think when it comes to addressing such challenges, we need very intentional, deliberate steps to addressing the same. Like as you have mentioned, is that looking into the very specific gaps that are existing. The government, the CSOs, and private individuals who are able to provide such services should work collaboratively to make sure that this is available to everyone. So it is all our collaborative effort. It is all our very deliberate ways of looking into this thing holistically. So everyone and all of us must come together.
That's very
can I
true.
add a
Of
voice on
course,
that?
please.
Yeah, so I think what Toimasi has said is there, and we are very cognizant of the gaps that are there. But I think there are also effort that some counties are putting to see that their citizens or the members of the county are getting quality healthcare services. I'll just give an example. There's a time we went to Kwale County, and we were doing a survey on neglected tropical diseases, specifically hydroceles and lymphatic. And for me, I was really impressed by what that county is doing, and I felt it's a very commendable thing to talk about, because I realized that everywhere we went, because we were doing a survey in the healthcare facilities, that everywhere we went, there was a new structure, an improved facility, healthcare facility in every single healthcare dispensary that we went to. And I really felt like, these are an effort that the county is putting to ensure that the community members are getting the quality service that they deserve. But sadly enough, there are so many counties that are not doing that because there's so much money that has been allocated for the different healthcare facility services and even improvement of these facilities, but we still do not see what is happening. We don't see any change. In Kajiado County, there's a policy that AMREF influenced healthcare. It was an improvement policy, healthcare facility improvement policy, but okay, it's something that we have seen that has worked, but I can say that we still have so much to do, because if you go to Kajiado County, there are still so many mothers that cannot access the healthcare services that they need due to the poor road that we have, and so many other things, challenges that we are going through, lack of money to even pay for the services that they need. And that is why community health insurance approaches should be brought, so that we are sure that every community member has a healthcare insurance, which can be able to cater for them when they do not have money. And sadly, that is, I think it's something that in our country we still have to work on, because not everybody has access to healthcare insurance. It's only for those who are employed, but for the community members, we are still far from seeing that everybody in the community have at least access to insurance, health insurance. Yeah.
And I'd like to point out that what Gideon said about devolved functions, and what you're saying about how different counties have different healthcare services based on who's in power at that point.
Yeah.
If I remember correctly, when money was coming from Nairobi from the treasury, every Nairobi was the county that made sure that what was happening in Kajiado, in Nyeri, etc., it was kind of uniform, but you did not really see progress.
Yeah.
But now with devolved systems, it now depends on the person who's in charge. And if, for example, Gladys Wanga in Homa Bay, she does a fantastic job, especially for maternal and neonatal health, especially when it comes to finding women who have obstetric fistula and fixing those problems. And AMREF actually was part of and parcel of that. We were there to source the doctors, and the doctors came to the county to perform surgeries on women who have obstetric fistula. But you are right, Kajiado County does have problems in terms of poor roads, in terms of health financing and of financing. And at the end of the day, every Kenyan should have access to social insurance for healthcare purposes. So whether NHIF is working, if SHIF is working, ideally you should still be able to access healthcare services without having to pay, because healthcare services are exorbitant. Another thing is that the difference between public and private hospitals, right? Public hospitals, a lot of the people who work there are burnt out. They have way too much on their shoulders. And in private hospitals, healthcare is way too expensive. So how can the government then come to bridge these gaps that exist within these spaces? Yeah.
So I think there's something that's very important that you've talked about, and that is the when a new government comes in, they usually fail to do what the other government was doing. Basically, it's like whoever is on power has the capacity to do whatever is supposed to be done in that particular county. And I think that is one of the challenges that we are seeing in our counties, because you'll find sometimes the different leaders that we have different priorities. You see, maybe for the current leader, health is not their priority, but the other one, health was a priority for them. And we've had issues of what has been started by the other leadership, it is discontinued. We don't see anything being continued from there, because you'll find maybe the other leader had started building a hospital. So when another leadership comes in, nobody's looking at that. They're coming up with new projects, whereas we still have some pending projects that are supposed to be done. And I think that is one of the challenges that we really have with the devolved systems, because we have to make sure that whoever is coming in, if there is an incomplete project from the previous government, the incoming government should take up on that project, because that is where we see there's a lot of funds that are being lost because of such cases. And even looking at the Auditor's General report that we have been seeing during the Gen Z demonstration, we've seen we have a lot of issues at the county level. Yeah, we have a lot of issues, especially on issues of the projects that are there. A lot of money is spent, a constructor has been paid, but nothing is seen at the county level. Yeah.
So now I have a question for you, Grace. How is AMREF investing in empowering young people to contribute to positive health outcomes and advance community health advocacy?
Yeah, thank you, Halima.
You're welcome.
I think AMREF is very cognizant of the challenges that are there in the healthcare systems. And looking at the AMREF corporate strategy, which started from 2023 to 2020,
2030.
2030.
Yeah.
Thank you. AMREF has a mission of transforming the health of the communities through primary health care, and with a focus on women and young people. And I think we're also cognizant of that there's a lot of challenges when it comes to access, the quality of services that the community is getting, the resilience of these systems, and also the accountability issues. And for us, AMREF, I think we have so many programs that are really geared towards improving and even strengthening the healthcare systems. And one of the ways that AMREF has really been working in the community to ensure that the kind of services that the community is getting, one, it is quality, and then also they have access to these services. We have so many programs, and I think that is the first level where AMREF really is ensuring that the community has access. And these programs we have the health programs that are geared towards improving access to healthcare services, and then secondly, we are working with young people to ensure that they are part and parcel of advocating for the changes or even a transformation in the healthcare systems. And one of the programs that we have currently, like the Power to Youth, where I am in the Power to Youth project, we are closely working with the young people as co-creators of this intervention, so that we make sure that whatever project or whatever intervention we are coming with, the voice of the communities there, the needs and the priorities of the community are incorporated in these interventions. So it's like a top-down approach to ensure that whatever solutions we are coming in with for the community, it speaks to their needs, it speaks to their priorities, because that is where we usually have an issue where we come with our own interventions, we go to the community, maybe we say that this community has an issue with water, but they don't have a problem with water, they don't need water, well, they are in dire need of healthcare. But for us, we feel like maybe the community is in dire need of water. Yeah, so we have at the center of our intervention the young people as the co-creators. We co-create with them interventions. We co-create with them these interventions. And these projects and even the programs, they are very youth-centric, so that we can have the voices of young people in these programs. And young people are very crucial because we have seen various outcomes. We are working with different models like the youth parliament, where the young people have been able to conduct the social audits. It's like a social accountability, a community social accountability approach, whereby they're able to go to a health facility, see what is going on in that facility, what are the challenges that health facility is going through, and what can be done. And through us working with the young people, we have seen that young people are writing petition to the county government, maybe to review a certain policy. We've been working with Toimasi in Kajiado, where we had a petition to have sand harvesting policy be drafted again, because there are some issues that were not there.
Sand harvesting?
Yeah, sand harvesting.
Why are you harvesting sand, if I may ask?
Sand has to be harvested because it is the one that is being used to build these buildings in town.
Oh, okay.
Yeah, so they usually go and get the sand from the rivers. Yeah, and then they come and sell in these different markets that we have for the sand.
Okay.
Yeah, so young people have been at the forefront to advocate for policies and also for the budget allocation to the different healthcare needs. They have drafted memos, we've done position papers where we have been able to influence budgets for the healthcare systems. And one of the things that we have noticed that we have had issues, as the way Toimasi said, accountability is a very big problem at the county level, because you'll find in most cases there's so much money that has been allocated, but how that money has been used, nobody can really tell how that money has been used. So the young people have been at the forefront to really influence accountability at the community level and even at the county level, because we are able to follow up on what has been done. And the young people, for example, in Migori County, they were able to influence the budget in the previous CIDPs. What is CIDP?
What is CIDP?
The county integrated development plans.
County integrated development
county
plan.
integrated development plans. They're able to really influence for allocation of budget to some SRHR needs, because you'll find that even SRHR is
sexual
and
reproductive
reproductive health rights is usually left out when it comes to budget allocation. So that is how we have been working with young people to ensure that we have access to, that the community have access to healthcare. There is accountability, and also these systems are resilient to the different changes, and also the community have quality. That is, they are satisfied with whatever kind of services that they are being provided at the community level.
Healthcare should be a human right, and also it's about social accountability. But my last question for both of you is, how can young people collaborate with healthcare institutions, governments, and other stakeholders to amplify their impact in the health sector?
Okay.
And if Grace, you can go first.
Yeah, thank you, Halima.
You're very welcome.
Yeah, so I think one thing that should be taken into consideration is that young people has to be at the center of decision making when it comes to issues of healthcare, because young people have been left out. And if you go to these spaces where the healthcare personnel or the different departments and the relevant authorities, we still do not have a representation of the young people. So where do we begin with? We begin with the representation of young people, because in most of these spaces, you'll find that young people are nowhere to be found. And it's because they have not been given that chance and access to these platforms. So for young people to even start collaborating with the different healthcare units, there should be a space where young people can be part and parcel of the decision-making processes when it comes to healthcare. Yeah.
And you, Gideon?
I think partnerships is very key, because if I am able to work collaboratively with AMREF, collaboratively with a healthcare facility, so as to identify certain gaps that need to be addressed, then I think value is, there is value in terms of building that partnership between youth serving organizations, the health facilities, and the government, so that we can address these things holistically. The other thing that we need to do from the young people's perspective is that we need to really come strong when it comes to policy engagement, because if we do not sit to influence decision making, if we do not sit to audit certain policies, if we do not really understand or push for a need-based sort of an approach when it comes to policy making, then we may have so many policies done that will not be reflective of the needs that communities have. So if we do that, we will be able to understand where do I need an intervention, and what intervention suits a situation or whatever. And the other last thing that I want to mention is that young people are really progressive, and they are, if we are to ask of the many people going through school and all that, they are very key when it comes to providing aid in terms of research, and also looking out for key interventions in terms of innovation around health and bettering or improving the healthcare service provision. So basically, I believe that young people would really come in handy when it comes to doing research, providing that which is needed in terms of the skills, providing that which is needed in terms of innovative ideas, bringing fresh blood into the system. Then the last thing is I value intergenerational dialogues, so that some people are traditionalists and they would want to believe that handling such matters that really require that we go through a healthcare facility, get tested, get some preventive measures or even curative measures. Some other person would believe that I don't need to go to a health facility because a herbalist is here, they could help me. But when young people come with skills, when they come with the knowledge, the science, our underserved rural communities will get to appreciate that some of these things and nearly every health condition need to be looked at by a doctor. Let them prescribe so that we, there is a very funny situation that when you go to the very rural parts of this country, somebody would be given some medicine that is just to help, for instance, in terms of the flu and cold and all that. But should I come having some back pain, I will share the same medicine with somebody who has been given something to handle or manage the symptoms of a flu and all that. Then if some other person comes with a stomachache, they would still take the same medicine that was prescribed
by a traditional doctor, yeah.
Or even a health facility, but they share the medicine because of lack of
commodities
and knowledge, when information is shared. So that is why I'm saying it is good we let this fresh blood that is full of knowledge meet the very traditional, the very rural, underserved communities whose literacy levels are very high. So basically, we have to sit intergenerationally so that we understand that this sickness, this condition must not go through a herbalist, go to hospital, and it is only young people who can collaborate with communities and health facilities to provide such.
And you've made some very valid points, because at the end of the day, intergenerational dialogue is needed. And at the end of the day, public participation is still greatly valued. And a lot of times you'll find that in public spaces, young people are not included, and they are quite literally the majority of the population in Kenya.
Yeah.
So thank you, Gideon, and thank you, Grace, for sharing your insights and experiences with us today. Your work is truly inspiring, and it's clear that youth have the power to transform the health sector. And to our listeners, thank you so much for tuning in. Remember, the future of health is in your hands, and every action counts. If you have any thoughts or feedback, please reach out to us on social media, which is Twitter at @amref_Kenya, Facebook, which is amrefke, and Instagram, which is #amrefkenya. We'd love to hear from you, and goodbye for now. And